We will begin with the need to continually evaluate and reevaluate the patients you are caring for. Evaluation begins with good observation skills. Observe the pet's attitude, appetite, and appearance. This includes but is not limited to their food and water consumption, the amount of urine and feces they are producing or not producing, as well as any unusual symptoms they may exhibit, such as coughing, vomiting, diarrhea, or labored breathing. Are they able to rise, or are they confined to a lateral recumbent position? Do they appear to be in pain? Are they responsive to affection and interaction? Your ability to observe these sick animals and monitor their changing condition is often vital information for the veterinarian and medical team. Good decisions are made only when all the information is available. You are a key player in acquiring the facts necessary in order to make sound medical decisions. Another element of this evaluation is the collection of the patient's vitals. We call this the TPR, which stands for temperature, pulse, and respirations. This information may be requested for each patient on a daily basis or as often as hourly with some very critical patients. These three parameters provide objective information to the doctor about the patient's progress. A temperature is very important as it may reveal to the doctor an infection, an inflammatory response, a compromised circulatory status, and much more. The temperature is taken rectally in most cases. The thermometer, if it's not electronic, should be thoroughly shaken down, as some patients will maintain a very low temperature during their illness. Remember that a normal temperature for dogs and cats will range between 100 and 102.5. The pulse is best measured by feeling the femoral artery in the inguinal area, just inside the rear leg. If the pulse is weak or irregular, this is important to denote in the medical record and communicate to the veterinarian. A heart rate is sometimes substituted for the pulse rate and can be easily measured with a stethoscope on the left chest just behind the left elbow. Count the number of beats in 15 seconds and multiply by 4 in order to obtain the number of beats per minute. The heart rate varies based largely on the size of the pet, with normal values ranging as low as 70 beats per minute in very large dogs up to 200 beats per minute in small dogs and cats. The respiratory rate is the number of times the animal breathes during 1 minute. It too can be calculated by counting the number of breaths an animal takes during a 15-second interval and multiplying that number by 4. Normal respiratory rates will range from 14 to 30 respirations per minute. If the breathing appears labored or shallow, this information should also be communicated. Whenever a patient displays abnormal vitals or other unusual symptoms, it is very important to notify the attending doctor as to your findings. You, in many ways, are the eyes of the doctor if you spend a great deal of your time working in the treatment ward or areas where hospitalized patients are housed. You may be in a much better position to observe sudden changes in a pet's condition than the doctor. It is also very important that thorough and accurate record keeping takes place. Any observations should be documented in the patient's medical record. Even if the observations or values are normal, take a moment and enter them into the medical record. When working as a team to provide care for the sick patient, it is absolutely essential that all team members communicate effectively with each other. When communication breaks down, medications get missed or are given twice. Serious changes in a patient's condition are overlooked, or many other serious problems might occur. Communication is absolutely vital to the health and recovery of the hospitalized patient.